Okay, so I made that video about the questions that I asked when I went to my consult, and I've been getting a lot of questions regarding answers to specific questions, so I'm going to go ahead and remake this video with the answers that I got to the questions. Now, I mean, these are my answers from my surgeon. Every surgeon is going to give you different information and, does things differently, and everybody's body is different, so what's the answer for me may or may not be the same for y'all, so just keep that in mind. Let's see, go through here. The general questions, the blood work that I have to have done is like a red blood cell count, because testosterone increases it, and they find that you heal better, or in Dr. Raphael's experience, you heal better from the lower blood pressure and the lower red blood cell count, which that part doesn't make sense to me, but I'm gonna trust him. The additional costs for revisions, there are none. Any revisions are free, except I have to pay for, I believe, like the OR time and the anesthesiologist. He told me that some of the complications that past patients had encountered were like just infections or hematomas. He said most of them are from not taking it easy enough, trying to do too much too quickly. As far as the sensation in my nipples, you're cutting the nerve lines. There's a very, very, very remote chance that you'll get some tactile sensation, but erotic sensation is almost guaranteed to not happen. And he said that given time, they'll look normal and they'll work again, response to cold and whatnot. He said that I should have sensation in the rest of my chest. It may take a while to come back, but if I don't have that within, I can't remember if it was 1 year or 2, but it may not come back. He said that the infection rate was, I think he said it was like somewhere between 2 and 5%. It was really low. As far as the working out beforehand or not, he told me it's really not going to make that much of a difference, and that part of that is because, my consult was 3 weeks from my surgery date, so if my surgery date had been farther out, it may have, his answer may have been different, I don't know. The smoking thing, I need to quit for 2 weeks before surgery, and I'm doing pretty good with that. I'm averaging about like 1 a day right now, and that needs to get to 0 real quick, I know, but anyway, as far as what I can do from now to surgery to minimize the negative consequences, just take care of myself, get my vitamins, my nutrients, and stop smoking. And the testosterone, he wanted me to, I discussed that, 3 weeks ahead of time. And the other reason for that he mentioned was, it's pretty taxing on my liver, and I'm fixing to put my body through quite a bit. So any extra stress that I can remove would be beneficial. As far as the vitamins and stuff to help speed the healing and keep skin elasticity, he said that, once again, just a good diet, with all the vitamins and minerals you need. He didn't tell me not to take anything before or after surgery, but I don't take anything on a regular basis anyway. I actually really dislike medication, so let's see here. The detail of the procedure, he's gonna make the incision. If I remember right, I was a little excited and halfway paying attention, which is I think why they give you a pre-op appointment as well, so you can pay more attention and catch what you missed. But anyway, he's going to make the incision right above my nipple line, and he's going to extend it up in my arm just a little bit, and then he's going to bring that, and he's going to remove all the ductile tissue and all the fatty tissue and all that good stuff, all the glandular tissue, pull that all out, and then take that flap of skin down to meet down here, and then graft the nipple back on. I need to ask more questions about that, but I'll let y'all know after my pre-op that I have on Monday. As far as scar placement, he said that he's going to follow my... some of them he does straight, some of them he does curved. He says he's going to have to get in there and see what's up. Nipple placement, he was discussing, there's a formula that they use for it, something about between X ribs and whatever. I just kind of said, side effects, he said that, some people will get pretty nauseous from the anesthesia, but as many times as I've been under, I've never had that problem. But they also may be adding Phenergan to it as I come out as well to kind of curb that nausea. I'm not sure. I'll talk to him about that tomorrow or Monday too. The complications, the possible complications were like hematoma, or if I'm not careful and the drains get pulled on, or if I move too much I can rip stitches, or even after the stitches are out I could move too much, and the more stress I put on the area, the wider that scar is going to be and the higher the likelihood of hypertrophic scarring is going to be. When I asked him how long the procedure itself will take, I think he said like somewhere between an hour and a half and 2 hours. I need to ask a lot of these questions again. When I asked him how long I'd be in recovery, he said that's up to me, and I know that I'm going to be in there for quite a while because I know I'm pretty hard to put under and I'm really hard to get out. They usually have to put a shot of norepinephrine in my IV to help me start coming around. The pain meds, he said something about Percocet, something else. He listed off 3 of them, I think, so I'm going to be in a pretty gnarly medically induced coma for about a week, I'm sure. So the average healing time is about 4 weeks or so until you can, start doing most of what you would normally do. As far as I asked him, about what he recommends that I use on the scars, he said something called paper tape, or those silicone strips. I've looked into those. Those are pretty expensive, but I think it's going to be worth it. I think I'm going to go ahead and invest in a couple sets of those. And he told me that I was going to be wearing that surgery compression vest for, I think he said 4 weeks. And then his assistant told me that a lot of guys end up wearing them for 6 weeks or so, just a little bit longer, just because that compression on there feels good. And it helps, get the skin to adhere to the muscle. And when I asked if it was beneficial if I wore it longer, she said past, 4 to 6 weeks, it's not going to hurt or help anything, but it may be for a personal comfort thing. Apparently those nipples get pretty sensitive to t-shirts rubbing against them and stuff, which makes sense. I was told that because my job is pretty physical, I need 6 weeks, about 6 weeks off of work. When I asked him how long I needed off work, so, and he gave me a little bit of an extended time off because, I told him whatever he thinks I need, don't worry about it because I do get paid. So I've got the time to cover it, so I'm good there. I have to go to follow-up appointments, if I remember correctly, the day after, and then about 1 week after, and then 1 month after. And I think he said he wants me to come in at 6 months and a year as well. I'm not quite sure. And then, I was asking what will I need from whoever's taking care of me, and he said, for the first 48 hours, I'm going to be pretty much totally dependent on you know, my friends that are going to help me. It's going to be Sam and Cole, so that'll be pretty cool. He said it'll be, I think he said 2 weeks before I can drive, but I'm gonna have to, I'm sure he'll go over all this again with me. When I asked what I can do to help to reduce the bruising, there was some supplement he told me about. I know a lot of guys have talked about it before, so if you know what it is, I want to say it's like arnica or something that may be a part of the word. I'm really bad with that stuff. And then the dressings, I'm going to change, after I get the drains out, I'll change the dressings every day, with the exception of the nipple dressings. Those are going to have to be changed out twice a day for quite a while, he said. I'm supposed to keep those wet dressings on the nipples for quite a while.